So we've known for a long time now that ctDNA or minimal residual disease testing is prognostic for patients who have resected colorectal cancer. And now with more longer term follow-up, we're getting a more enriched data set where we can make some more conclusions while we await the results of some prospective randomized studies truly trying to assess, can we use ctDNA in the adjuvant setting to make clinical decision-making regarding who should receive adjuvant chemotherapy or not. And kudos to the Japanese using the Signatera platform. This is a tumor-informed ctDNA platform where they enrolled over 2,200 patients in a large prospective observational study across different stages of resected colorectal cancer. And really, stage for stage, they show that, again, ctDNA is prognostic. The focus is on this window period of MRD positivity or negativity, really at the 4-week postoperative time point, which is typically prior to the receipt of adjuvant chemotherapy. And if you're positive at that time point, it's bad, but that is the group that does seem to derive the most benefit from adjuvant chemotherapy. And with longer follow-up, we're now seeing sort of a third group of this sort of transient ctDNA clearance. So if you're ctDNA positive, about a third of those patients clear and stay sustained cleared. They do quite well, and virtually none of them recur. There's about a third of patients, or slightly less than a third, that have transient clearance, whereby on chemotherapy, their ctDNA clears, but then it recurs or becomes positive really pretty early, usually by 6 to 12 months, and all really by 2 years in that population have recurred. And then there's a group that doesn't clear at all, which is about a little under a third again, and they do by far the worst in terms of both disease-free survival and overall survival. So we've gotten a lot more data that this is a worthwhile test in my estimation, but also, again, as we await the results of these prospective randomized studies looking at treating these populations differently, again, knowing that the positive group derives the most significant benefit from adjuvant chemotherapy and the negative group derives little to zero benefit depending on stage. Hopefully we can then use this test, in the clinic to really decide who needs adjuvant chemotherapy or not.